Okay, we've got Dr. Natalie who just joined. Let's see, hold on, I'm going to, let's see. Okay, so we are good to get things started. Hey, Natalie, how's it going?
Good. How are you?
Awesome. Okay, hold on, I'm just going to, let me just fix my computer speakers. Okay, can you hear me?
I can hear you. Can you
Hey,
hear me?
amazing. Well, so excited to get this going. Thanks so much, everyone, for joining us. Um, I am so excited for this event tonight, and we are partnering with Golden Gate Mothers Group for this event tonight, which is an incredible organization. They do so much for moms to be and new moms, and so I think this is such a appropriate topic. You know, getting back to or even starting exercise postpartum, we get a ton of questions around this at Origin, you know, from our patients or just from people trying to figure out, you know, like, how do I kind of start to like feel like myself in my body again? And so we actually had a ton of questions from everyone who registered in advance. So I'm really excited to dig in. As I know, like, it's so important for both your mental and your physical health in that postpartum period to really feel reconnected to your body. So as a quick reminder, we are recording this session. So if you need to hop off or you need to go hang out with your baby or something comes up, no worries. We'll send this to everyone after the session. And like I said, there were a lot of questions that we got in advance, but as we're going through, really want this to be a discussion. So feel free to drop any questions into the Q&A or the chat box, and we'll make sure to cover those at different points as we're going through the content. So I will kick things off. I am Allison Grant, and I lead the marketing team here at Origin. And I think, you know, I believe in a lot of what we're doing, but I think at the end of the day, we are ultimately trying to make women feel their best in their body through every stage of life. And so that's the work we do is really through pelvic floor and kind of full body physical therapy around that. So if you're anything like me, you might not even know what your pelvic floor is or how it works, but we will touch on all of that. And I think the other really important piece to talk about when I'm talking about the work that we do is we believe access is super important in this as well. And so we are in network with most major commercial insurers, and just providing this care to more and more women is something that's really crucial to our mission. And from here, I want to introduce our speaker today. We have Dr. Natalie Russell, and this is such a treat because Natalie is not only an expert in the pelvic floor, but she also has her OCS, which basically just means that she's an orthopedic expert as well. So is super familiar with just the connection between your pelvic floor and the rest of your body and how that might be impacted when you're thinking about returning to exercise. Natalie is a native Californian, loves the outdoors, and really does take that full body approach to treating her patients through a combination of both manual therapy and exercise. And so with that, I will hand it over to you, Natalie.
Awesome. Thanks, Allison. Well, I'm super excited to be here and to talk to all of you. I can't tell you how often I get questions from people even before they're pregnant about how they're going to recover postpartum. So I know that you probably all have lots of questions, and I was able to look through some of the stuff that you wrote in already. But like Allison said, I definitely want this to be as much of a discussion as possible. So feel free to just chime in whenever you do have a question. So we'll be talking a little bit about just what is the pelvic floor, where to find it, how to use it, thinking about your body postpartum and how to get back on track and returning to exercise. And also thinking about, kind of with that in mind, when is it appropriate to work with a physical therapist? So we'll go ahead and get started. So I always think that this is really, really interesting. I think that there's a lot of reasons why doing physical therapy postpartum could reduce your risk of postpartum depression. But I think one of the things that happens when we're feeling depressed, postpartum depression is a really complex thing, I'm sure you all know, and just depression in general and our mental health in general. But one of the things that often happens with depression is we feel like we have kind of a lack of control over our situation. And that is so true for new moms. And physical therapy is just one of the tools to help you feel like you can gain more control over your body. So
Yeah, I mean, this
kind
one
of a
always
fun
gets me.
fact.
I just feel like if there's any correlation here, it's like probably, like why it feels like something that you just should just totally do.
Yeah, exactly. So what is my pelvic floor and what does it do? So essentially, your pelvic floor is a group of muscles that lives inside your pelvis. I actually realized that I'm just staring at a pelvic floor model here. So we can just add another visual here. So we have different layers of the pelvic floor. We've got this kind of superficial layer that kind of lives in the labia. It creates the openings of the urethra, the vagina, and the anus. And then inside, we've got this deeper layer, which is where the pelvic organs sit. And so it kind of creates a hammock in the pelvis. And when the pelvic floor muscles are relaxed, they live down low in the pelvis. And usually those holes are a little bit more open. And when the pelvic floor muscles contract or shorten, they live up high in the pelvis. And usually the muscles or the holes get a little bit smaller. So they've got a lot of different jobs. Not only are they supporting the pelvic organs, but they're helping us to control continence, sexual function, and they work along with the other muscles of the pelvis, the hip muscles, the back muscles, the abdominal muscles to support the whole structure. So the whole, not just pelvic organs, but the pelvis itself and the spine. So they've got a lot on their plate. Your body, how does the pelvic floor function change during pregnancy and postpartum? We've got a lot of things going on. I think kind of when you're pregnant, you can think about both the abdominal muscles and the pelvic floor muscles help to create kind of a flexible wall, right? A flexible container for the abdomen where the pregnancy develops, right? So over time, the abdominal muscles and the pelvic floor muscles begin to stretch. So the pelvic floor muscles stretch down and the abdominal muscles stretch out. And as this happens, the position of the pelvis actually changes. So normally our pelvis sits where the front of the pelvis is a little lower than the back of the pelvis, but that becomes even more exaggerated during pregnancy. And it turns out that because our pelvis is connected to the rest of our spine, that's going to have effects all the way up. So it allows kind of the upper back to round a little bit more, head comes forward, and it actually makes it a lot harder usually to access some of the muscles that attach to the spine and pelvis, like the abdominal muscles and like the glute muscles. As things kind of stretch out, particularly the abdominal muscles, they come together in the front of the abdomen and they connect into this connective tissue called the linea alba. And that connective tissue starts to stretch over time and the abdominal muscles kind of get farther away from each other. So you might have heard of this as a diastasis or diastasis. You can say it either way. And we actually anticipate that that happens in pretty much everyone. Up to 100% of women in some studies will have the presence of a diastasis. And it's not always that significant. We can talk more about that a little bit later in the slides. So thinking about how one of the things that's really notable, right, when you are pregnant and then suddenly you are no longer pregnant because the baby is now out of your body, is that for the abdominals and the pelvic floor, they slowly had the load and the demand and the stretch applied to them over the course of several months. And then the pelvic floor muscles got a really big stretch all at once. And then we're just kind of expecting them to go back to how they were before. And that really takes time, right? So during the first few weeks, you can kind of expect that if you have a sensation of maybe extra heaviness on the pelvic floor, that kind of makes sense because the muscles are still kind of recovering from that big stretch that they had. They might have a harder time doing their job. So a little bit of leaking urine often occurs, but it doesn't happen to everyone. And it usually resolves, or it often will resolve over time. And if it doesn't, that's definitely a time to check in with a physical therapist. But you can start to retrain your pelvic floor muscles pretty much right away postpartum. So particularly if some of you are really early postpartum, it's safe to engage your abdominal muscles. It's safe to engage your pelvic floor musels.
Really, and how would you like suggest they do that?
Yeah, I was just about to get to that.
Flexing? Like, what am I doing?
Yeah, such a good question. I saw that was a question that someone had too. Like, what is a beginner exercise for retraining your pelvic floor? So the way that I usually do it, probably the easiest way to do it, is to do it with your breathing. So our pelvic floor muscles move naturally with your breathing. So if y'all want to try this right now, if it's cool with you, you're going to take your hand and you're actually going to sit on it so that you have like a finger or two on the perineum. And the perineum, just in case you don't know, it's this space right in between the vagina and the anus. And just close your eyes and allow yourself to just kind of be heavy on your hand and start to breathe. And as you breathe, you'll probably start to notice that the pressure on your hand changes. Typically, as you inhale, there's a little more pressure. So this is the pelvic floor muscles moving down, lengthening. And as you exhale, you can probably feel there's a little bit less pressure. That's the pelvic floor muscles contracting. So as you continue to do that, what you can try to start to do is, as you exhale, see if you can start to contract the pelvic floor muscles gently. And there's different cues that can sometimes work with people. So probably the one that is the easiest for most people to get a hold of is thinking about either squeezing the anus or trying not to pass gas. Or sometimes a cue that can be helpful is thinking of like you're trying to pick something up, something small like a blueberry with your vagina as you're exhaling.
Natalie, we had a question just like as you're talking through this.
Totally.
Like, is thinking about this, should people be thinking about this differently if they had a vaginal birth versus a cesarean birth?
Great question. No, it's all the same. And sometimes people don't realize that even if you've had a cesarean birth, that your pelvic floor muscles still had, particularly some people will end up pushing for a little bit before having a cesarean. And so their pelvic floor still gets some extra stretch. But even just going from a pregnant state of being, 9 months pregnant to not pregnant, the pelvic floor is a little bit in shock. So nothing really changes in terms of retraining the pelvic floor muscles postpartum, whether or not you've had a vaginal delivery or cesarean. The one thing that might change is that, let's say you've had some tearing of the pelvic floor muscles. A lot of times you might find that it might be a little bit more difficult to contract the muscles initially. So what you might try is doing these contractions instead of doing them in a seated position, because when you're seated, you're actually working against gravity. You have the weight of the organs on your pelvic floor. You might try it lying down or even with the pelvis elevated. So, you can kind of imagine if you make a little wedge where your butt is up, then that way you're working with gravity. Gravity is helping you to contract your pelvic floor.
Well,
great. And then other things to kind of think about postpartum is, I would say the biggest thing that people come back and say is that they started doing too much too soon. And so, what I really like to encourage people to think about is in those first couple of weeks postpartum, to just remember that what your body went through is the same as a major surgery. So to really take it easy, those pelvic floor contractions, you can do a similar type of engagement of the abdominals right off the bat, along with the breathing. And then otherwise, it's just gentle movement, walking, and thinking about stuff around the house, thinking about kind of incrementally increasing your activity. So like first week, you're going to be mostly in bed, walking maybe just around one room. Second week, maybe you're walking around the house. Third week, maybe you make it around, just to the end of the block. Fourth week, then you're maybe starting to walk longer distances around the block. And then at 6 weeks, then once you're cleared by your OB, then you can usually start to returning to some higher level exercises. But again, you haven't done that much for 6 weeks postpartum. A lot of times people are like, I was cleared for exercise, I'm going to go for a run. But it's still usually a little bit too soon for that. So starting with things that are a little bit more low impact and then working your way up to higher impact. And we'll talk a little bit more in detail about that in a little bit.
Yeah. And when you, when you think about, knowing your limits, I guess, what should you look for, or how do you know if you've done too much, or are there any warning signs to be on the lookout for?
Absolutely. Yeah. So I would say depending on how in tune with your body, sometimes people just notice that oh, I did this workout and my abdominals were just fatigued. It just felt really hard to hold myself up afterwards, but they maybe didn't experience any pain. That is typically a sign that you did too much too soon. In general, when we're getting back to exercise, if you have soreness that lasts more than, maybe a few hours, or a couple of days afterwards, if you did a workout yesterday and you're sore for 4 days afterwards, you probably did too much too soon. And when we're talking about things like the abdominals and pelvic floor, you might notice that, oh, it's fine if I'm lying down, but if I'm standing, it actually feels like pressure or pain, kind of in the area of the vulva or the perineum. And then definitely as it relates to the pelvic floor, if you're having any sort of leaking, particularly if it's associated with activity, or a lot of times I'll have folks who didn't have any leaking immediately postpartum, and then once they started exercising, they started to have some leaking. And this isn't always urinary leaking. Sometimes people come in and they're like, this weird thing happened. All of a sudden, I started exercising and I was just, farting everywhere. And they don't, you don't realize that, yeah, that's actually your pelvic floor muscles are telling you that they're having a hard time doing their job when that's going on. Great. So thinking about, once you've now been cleared for exercise, thinking about how you're going to get back on track. I usually like to give people the analogy of that couch to 5K concept, where, you're not going to be in that same state that you were, particularly, some people are like, well, I was running half marathons before I got pregnant. But then, didn't run during pregnancy. So it is going to change a little bit depending on what your activity level was like during pregnancy. But, you really want to think about if my goal is to run a 5K, let's say, I need to start by doing some intervals of maybe running and walking. So I usually have people start with just 1 minute of running and then a couple minutes of walking. And usually things that are higher intensity, like running or heavy lifting, I usually recommend, I know this says 3 months, which is the general recommendation. I'm personally just a little bit more conservative with it. And a lot of times I have people wait 4 to even 6 months, depending on what their situation was like. And to think about kind of what are the things that I would need if running is my goal. I want to make sure that I have strong hip muscles. I want to make sure that I have good control over my pelvis, so strong abdominal muscles. So those are the types of activities that I'm going to start to work on to get towards running. I know that was a specific question that someone had, was exercises to work on to get towards running. So I think about things like bridges, clamshells, where we're focusing on the hip stabilizing muscles. Starting with things that are not really working so much against gravity first, building up the strength there. And then you'll take it to things like squats and single leg squats, deadlifts, all with body weight first. And then maybe you might take it from squatting to jumping, and you can jump kind of forward, back, side to side on both legs. And then you do the same thing on one leg. And then once you feel like, okay, like if we're talking about like sports world, usually the return to run classification is like, you want to be able to do 25 single leg hops with good technique before you can start initiating a return to run program.
I don't even know if I can do that. I didn't even have a baby.
When I first learned that, honestly, Allison, when I first learned that in PT school, I was like, oh, I for sure cannot do that. And I was running half marathons at that point.
Yeah.
So yeah, knowledge is power.
Totally. And is there any, like when you're thinking about the running, is there any difference there, especially like if you've had a C-section versus vaginal, or is that it's a similar trajectory regardless?
It's a similar trajectory regardless. I would say typically, although not all the time, C-section often may have a harder time getting the abdominals back online. And a lot of times that can be a result of just kind of restrictions actually in the tissue that occur because of the scar. So making sure that particularly with C-section, that in addition to abdominal retraining, that you're also doing abdominal massage and scar massage. And that usually you don't start with kind of more intense direct scar massage until at least 6 to 8 weeks once the scar is fully healed. But even immediately postpartum, you can start to do some abdominal massage away from the scar to just kind of keep the tissue moving. One of the things that I like to do kind of postpartum, I don't know if y'all can see me, but if you just kind of take your hands to your belly on either side, and you can just kind of squish the tissue from right to left and kind of pull it up and down. So as long as you're not pulling directly on the scar, that should be safe, you know, because the scar is way down here, you're kind of up here, just kind of keeping things mobile. Or you can go kind of even just along, you know, just above the scar, just kind of sweeping across. And I'm not putting much pressure at all, you know, kind of if I'm thinking of like, yeah, like a tomato. I was actually thinking like if I were going to just pet my cat, you know, where it's just like, just want her to know that I'm there.
Totally. And we had a couple of questions too, just around, you know, I know not everyone's a runner. Like I think there's a lot of people that do more like weight training. So like, how do you think about when it's okay to resume more heavy lifting or like building up to that?
Yeah, absolutely. I saw that question. And one of the things that's so hard about that question is what is heavy? Because for some people, 20 pounds is heavy. And for some people, 300 is heavy.
Yeah.
So, but I would say kind of the same idea applies, like the couch to 5K analogy applies to all sorts of exercise, right? So if I'm thinking, okay, let's say I want to get back to deadlifting. I want to make sure I have strong hamstrings. I want to make sure I have strong glutes, strong abdominals, strong shoulder blade muscles. So I'm working on those things first, isolating them. And then I'm starting to work toward the movement itself, doing it with body weight and then really light resistance. Someone had asked, I think also like exercises to do with baby. I think heavy lifting, returning to heavy lifting is like such a great thing to do with your baby, particularly if you're doing things like squats or overhead presses, because you've got this weight that is just getting heavier as you keep going. So, or as they keep growing. So you can kind of think about, you know, you can start doing squats with your baby. A lot of you are doing that already, probably if you're kind of rocking your baby, trying to settle them. You're probably doing little mini squats. You can turn them into full body squats. You can do an overhead press with your baby. But kind of same idea. When you're starting to get into heavier pounds, like probably over 20 to 30 pounds, thinking about this same concept of the demand that that's going to be on the pelvic floor muscles. So probably not starting that before 3 months. And in the meantime, you're working up by doing the same thing without resistance and then really light resistance and just working your way up slowly over time.
Got it. That makes sense. And then I know we have, several women that come into Origin and just in general that experience prolapse postpartum. And so there are exercises you can do if that's something that you are dealing with.
Yeah. So, I would say it definitely depends on the extent of the prolapse, but definitely working on the pelvic floor strength, abdominal strength, and hip strength are going to be really important for managing prolapse. I think another area that people don't really realize has an effect on prolapse is actually your shoulder blade muscles. So you can kind of think about how when we're talking about prolapse, essentially what's happening is the pelvic organs they live down lower now in your pelvis than they did before. So they're placing more pressure on the pelvic floor. And so you can think about how that's also going to be influenced by the position that the pelvis is in. So typically, right, the pelvis is tilted a little bit forward. So when the pelvis tilts a little bit backward, meaning kind of the tailbone's tucked under a little bit, that's going to reposition the pelvic organs a little bit closer to the vaginal opening. And that is, that happens so easily. I don't know if I'm going to try and make it so that y'all can see me again, but if I kind of round my upper back, you can see that right away, when I rounded my upper back, my tailbone kind of tucked underneath me. And this also makes it difficult for me to utilize my abdominal muscles to their fullest potential. And so often, because you've got your tiny baby, you're walking around, your upper back is rounded, that just becomes a position that you end up being in a lot of the time. So I think definitely paying attention to strengthening shoulder blade muscles, foam rolling the upper back, keeping it mobile. And then a lot of the same stuff that we talked about already, strengthening the hips, strengthening the pelvic floor.
You're making me just think about standing up straight.
I know.
I've got to engage my abs.
Honestly, you can ask all my patients. One of the first things I do when they come in is okay, let's look at how you stand. Yeah. And they're like, oh my gosh.
Yeah, not well.
Yeah.
Awesome. And then maybe let's touch on DRA too.
Mm-hmm. So this is a really common thing that I see. And so essentially we talked about this earlier. You can see Allison added a really nice visual for us, but we've got this tissue in the middle of our bellies where our abdominal muscles attach into. The one thing that I don't like about this picture is that this shows us just the six-pack abs, whereas we actually have the other layers of abdominal muscles that live underneath the six-pack abs that also attach into that tissue. And so the function of that tissue is really just so that you're able to allow the muscles on the right side of the abdomen to communicate with the muscles on the left side of the abdomen. And so this tissue, it's kind of similar to the tissue that you might have in a ligament. So if you've ever sprained an ankle, you stretched a ligament, and you probably know that ligament didn't quite go back to the same amount of tension that it had before, because our ligaments, unlike our muscles, don't have the same sort of elasticity. But that doesn't mean that you would never be able to have a strong ankle. And in this situation, it doesn't mean that you would ever be in a situation where you can't have a strong abdominal wall. It just means that it might be a little bit harder to figure out how to get those two sides of the abdomen to communicate with each other. And so it is really common. Again, we expect that almost everyone is going to have it at the end of their third trimester. And that we expect that it's going to slowly start to get a little bit more tense over time. once you deliver the baby. But you can think about how certain types of activities where you're increasing pressure inside the abdomen, like for example, if you were going to be trying to do a crunch to get yourself up out of bed, that you can probably imagine that when you do that, the belly kind of pops forward. And that's going to increase the pressure inside the abdomen, which is going to make it hard to get the right side and left side to communicate with each other. So doing things like rolling onto your side, particularly immediately postpartum, using momentum to kind of push from side lying up into a sitting position by letting your legs kind of fall off of the bed are going to be helpful in minimizing activities that's going to just increase the pressure of kind of separating the two sides of the abdomen. And kind of that same thing that we did a moment ago when we were learning how to use the pelvic floor muscles with the exhale, that's a really great strategy to use when you're engaging your abdominals. A lot of the times what I see when I ask someone to engage their abdominals, the thing that happens, like if you put a hand on your belly and you say to yourself, engage your abs, your abdominal muscles should move in. Whereas a lot of times what happens is I see that people tense their muscles and push out. And so it's just a different strategy. That's a strategy that we need if we're doing a really high level activity, like pushing a car out of a ditch, but not necessarily a strategy that we need if we're picking up a 6-pound or a 10-pound infant. And so thinking about how to heal your diastasis, a lot of times the goal that people have is to make the separation smaller. And we actually know from research that may not happen, that separation between the right side and left side may exist for a long time. It may get smaller over time, but that it may not go back to what it was before. But that usually immediately postpartum is when we're going to see the biggest change. So usually in the first 6 to 8 weeks. One of the ways that you can check on yourself to see if you have a diastasis is I usually have people take their fingers, maybe like 3 or 4 fingers, and you place them on your belly. So I'm kind of right at the top in between where the rib cage comes together. And if you lie on your back and you kind of crunch up, you should feel that that tissue stays firm under your fingers. Sometimes what happens is you'll feel that 1 or 2 of your fingers kind of sinks in, and that tells you that there is a separation and that you're having a hard time generating tension. And then you just check all the way down to the pubic bone, because there can be that separation at any point. If you do feel that separation, what you're going to want to work on is, again, engaging your abdominals the way that I just explained by using your breath, doing most things in a neutral spine position. So things like lying on your back first, timing the abdominal engagement with your breath, then maybe working into things like hands and knees, standing, avoiding things like you can see crunches, sit-ups, brushing twists, planks, at least in the beginning. Once you're able to engage your abdominals adequately, eventually you're probably going to be able to do these exercises. But one of the things that you can look for is sometimes you can actually see the separation occur, because you can kind of see what's called a doming of the abdominal muscles if you were to do one of those exercises like a plank. So when to work with a physical therapist. So if you notice that you're having any of these symptoms, some of the stuff that we talked about that's normal immediately postpartum isn't normal down the line. So if you have heaviness, leaking, urine, poop, or gas, feeling like you have to go to the bathroom really frequently. So sometimes people notice like, yeah, I I had to pee way more often when I was pregnant. And then postpartum, that just never went away. I'm going, like once an hour, or I feel like when I have to go, it's like so urgent. Like suddenly I have to go and I've got to get there. Otherwise, I'm worried that I might leak. And then once you return to having sex or any type of vaginal penetration, or even if you kind of touch around the area, if things are painful, that's not normal. And that's definitely something that PTs can help with, or just, pain in the pelvic region. So that might be around the area of the perineum, the vulva, but sometimes people will, notice from maybe the position that they were in during labor, they might start to notice kind of hip pain or SI joint pain. And those are all things, if it's persistent, that you definitely want to talk to someone about. Do you want me to go through this list, Allison?
Okay. No, I think probably the most obvious one here would be is the childbirth. A lot of the audience that's on the call with us, but like I said, if there's questions, feel free to put it in the chat or the Q&A. I think we still had a couple other ones just from people who registered. And I know you touched on this a little bit, Natalie, but just with any sorts of exercises, obviously like pain would be a warning sign, but are there other like sort of telltale signs that might suggest, to pull back, or to, that it's maybe too premature for you to be doing certain kinds of exercise?
Yeah. I mean, I think we talked about pain. We talked about leaking. Sometimes it's also just that pressure sensation. Like sometimes people feel like, oh, I started lifting and I felt this pressure on my perineum. It didn't hurt. It didn't last for long afterwards, but it's continuing to happen, every time I'm lifting. So anything that's just like, this isn't what my body felt like before, it definitely takes longer than people really want to admit for your body to feel back to quote normal. It's always going to be a different body because you made a human. So that's cool. The body you had before didn't make a human. But it really does take a long time. But when it feels like it's like, even if you're just not sure if it's normal, that questioning is probably worth talking to someone about. I'm thinking of a patient that I had recently who just started having, like, her feet were just really sore in the morning postpartum. It was not true during her pregnancy. And, it would go away every day, but she was waking up every day with pain. And we realized that just she was barefoot now all the time, where she hadn't been before. And she was benefiting from, from just some like feet stretches and some foot strengthening. So even if it's not your pelvic floor, there's still things that can pop up because you're just using your body in so many different ways than you were before. Someone had asked, I think, about the difference between good soreness versus not in the abs post-workout, C-section specific. And so I'm kind of thinking about that person and trying to hopefully making sure that I'm interpreting the question correctly. But I think that they're wondering if, the soreness that they're having after using their abdominals is normal or if it is different. And I would say, if it feels like the same type of abdominal soreness you typically would have after an abdominal workout. So that's, a lot of times people will feel like, oh, I can kind of feel like the sides of my abdomen feel really sore. Like I got this, I can tell that I exercised my muscles, versus like if the soreness is just in one spot in the abdomen, that's usually not normal, right? Like it's usually going to be on both sides if you're sore in your abs versus just in one spot, or if it's right near the C-section, or if it's particularly sharp, that's another thing to look out for.
Yeah. And I guess, I feel like I've had a lot of friends who have been like, oh, I feel fine postpartum. Like, I'm just going to start running, even if, it's only been a month, or, I used to your point, like I used to do a half marathon, so I can do a couple of miles. I guess, like, what are the, is it bad to run with a weak pelvic floor, or kind of what happens if you end up doing that? If you're just, I feel like I have a lot of friends who I know who are like super gung ho. And so what happens if you kind of overdo it?
Yeah, great question. One of the things that's hard with this question is like, I don't have any guarantee that you're going to have an issue if you do this too soon. But what I can anticipate is that what might happen is your pelvic floor likely, because the demand of running is higher than walking and carrying your baby and kind of doing your day-to-day activities, that your pelvic floor is going to want to respond to that demand. And our muscles are really good at responding to the demands that we place on them when we apply them gradually. When we apply a load, let's say, or a demand too quickly or too much all at once, the muscle has a really hard time adapting. And a lot of times what that ends up meaning is the muscle then has a hard time doing its job. So it could result in pain, although not always. It could result in urinary issues. So that could be leaking, or sometimes it's actually, I sit down to pee and I actually like can't pee right away, or suddenly the stream is really weak. It could result in kind of more sensation of pressure. And then when you end up in a situation where you apply a demand too fast, too soon, and you keep applying that demand, then you have to really take a step back in order to get things back online. And so I think that doing too much too soon, whether it's pelvic floor rehab or like recovering from knee surgery, it really ends up prolonging the recovery process.
Yeah, that makes a ton of sense. If there's any other questions, feel free to put them in the chat, or otherwise, well, I think I have one more and we can wrap things up. There was a question around like running positions. Is there any like good ways you think about like just your form when getting back to running that will lower the impact on your pelvic floor?
Yeah, I mean, it's nothing specific to running postpartum versus running in general. But typically, some things that we want to think about are that when you're running, you want to lean forward a little bit, and that lean actually comes kind of down from the feet versus like just at the hips. And what that does is that allows you to engage your glutes a little bit better. And making sure, I would say one of the biggest things that I see in runners, particularly I think in postpartum runners, is that their stride is really long. So they suddenly start stepping their foot way out in front of them, which makes it really hard to use the glutes. So making sure that when you're running, when your heel lands, when your foot lands, that it lands right underneath you and not in front of you. And thinking about one of the ways that I usually like to cue you getting the glutes involved is to actually think about using your feet, like you're spreading your toes, you're using your toes to push the ground back behind you while you run.
Awesome. I'm going to take those own personal tips for myself.
Awesome. Please do.
Well, thank you so much,